When I was doing my research and interviewing the different HIV primary care fellowships, the people here at the program were very knowledgeable and have been doing HIV work for years, since the start of the epidemic, and have really seen how HIV has evolved from a deadly disease to one that is a chronic, manageable condition.
We have multiple different programs that are both academic and community-based that have been providing care for people living with HIV for a very long time, since the 80s.
This program came about really to develop that next generation of physicians passionate about the care of people living with HIV and HIV prevention.
I appreciated the attention to detail and the thoughtfulness with which they had structured the program. So in addition to having my own, panel of HIV patients who I'm the primary care doctor for, we have sort of concentrated time early in the year in PrEP, so HIV prevention, in gender-affirming care. We have time, doing focused work related to some of the cancers that are associated with HIV, focused time in a correctional facility, focused time, treating Hep C.
We also have a team-based model of care that incorporates multiple different disciplines, including social work, nurse case managers, pharmacists, that really help provide comprehensive care to patients living with HIV.
Our fellows will have a number of experiences. They will have a continuity clinic both in Oakland and San Francisco and work with attendings who are internal medicine, family medicine, infectious diseases, as well as get the opportunity to work with subspecialists.
The patient population was a very diverse patient population, and for me as a woman of color, wanting to serve marginalized communities, that was really important for me when I was looking for a program.
I can really feel myself growing into this program. I feel like I'm learning every day. I'm learning in a really supportive environment. Everyone is just so warm, so committed and excited about teaching.
Our fellows are very involved in research and have multiple projects going on, which is made easy by our integrated medical system as well as our electronic medical record.
There's a lot of stigma still that remains with regards to HIV, and we want fellows who will be willing to fight that stigma and have that passion and advocate for our patients, so that we live in an era where there's no new HIV diagnoses and that it becomes destigmatized.
I'm really excited to see how I will feel at the end of this year when it's time for me to really spread my wings and to go out into the community and to practice and to serve my patients. So.